Uganda is one of the 30 high-burden tuberculosis HIV countries in the world, with an annual tuberculosis incidence ranging between 200 and 350 cases per 100,000 people. Tuberculosis is the leading cause of death among people living with HIV, and despite being curable, is responsible for over 1/3 of all HIV-related deaths worldwide. The Ministry of Health in Uganda has today held a marathon run to increase awareness on the deadly TB disease and to fundraise for the construction of TB isolation wards at Iganga Referral Hospital.
Uganda is among the 30 high-burden tuberculosis and HIV countries in the world, with an annual tuberculosis incidence ranging between 200 and 350 cases per 10,000 people. It has been found that half of all patients with TB in high-burden countries do not complete treatment, resulting into prolonged infection, morbidity, drug resistance, and death. Ministry of Health has launched a community awareness screening, testing, prevention, and treatment named CAST Plus TB campaign to end TB at the ministry headquarters in Kampala.
As we implement CAST Plus, let us work together to do the following. 1, inform, educate, raise awareness among community members about CAST Plus, encouraging their participation and support. 2, mobilize sufficient and sustainable financing and other resources to facilitate the implementation of the campaign at all levels. All health partners in the districts are called upon to pool resources towards this CAST activity. Number 3, strengthen the integration of all health-related community activities as per the community health strategy and guide. I call upon you to integrate TB awareness and screening in all health-related activities you plan to implement at community level.
While launching the community awareness campaign, Minister for Health Jane Ruth Aceng says the purpose is to collect data on TB prevalence and increase awareness.
And when we talk about integration, we mean when you go out to look for TB, also look out for other diseases, hypertension, HIV, malaria, and others that you can look for, so that we can reduce duplication and fragmentation of the health interventions, optimize allocation of the limited resources, improve collaboration across programs, and strengthen our health systems so that we have sustainable impact of the health outcomes.
Consequently, tuberculosis treatment outcomes are still poor for patients co-infected with tuberculosis and HIV. She also launched a TB screening van for Ugandans to know their TB status, which van has been destined for Karamoja region. Poverty is key social determinant of health and crucial driver of poor HIV and tuberculosis treatment outcomes.
Right now, we estimate that about close to 300 people every day fall ill with TB disease. So 300 people every day. If you multiply by the number of days in a year, you can see how many we estimated to have. So that's why we remain among the highly burdened countries globally.
Meanwhile, Uganda National Tuberculosis and Leprosy Control Program Task Force has organized the TB Marathon to raise 2 billion shillings to construct TB isolation ward at Iganga Regional Referral Hospital.
And I would like to inform you that we are creeping towards 100 million mark. After this run, we are going to look at it and evaluate and see what amount of money that is also in the marathon that was held in Iganga. We want to add that together and we make sure that we start that project. But this committee also discussed other avenues other than only getting money from kids that you people are contributing very generously. but to look at other sources of funding and support to ensure that we achieve that objective, because we are going to have one more run towards that ward. The rest of the money should come from other sources.
A TB survivor says that an estimated 13% of tuberculosis patients are lost to follow-up, and 20% of patients diagnosed with tuberculosis do not initiate treatment.
My brother was still taking also the drugs. Also, the lack of some money for transport to go to the facility to get some medication, more TB drugs. So I lost them also, some two brothers. Those are 3 number, the people I lost in my family. So, after some time, like some 2 months after the death of my brothers, I also developed the signs of TB. They put me on injection. I took the TB drugs for 6 months, but he did not respond. I was put on injection 60 for 2 months.
A number of medals were awarded to the best runners in the 5, 10 and 15-kilometer respectively. Tuberculosis is the leading cause of death among people living with HIV and AIDS and is responsible for over 1/3 of all HIV-related deaths worldwide.
David, give me 2 more, there you go. 1 more, there you go. Take the side, go! There you go.
Douglas Setumba compiled this report.